As case numbers continue to increase, all eyes are on local hospitals. Hospitalizations at UAMS have doubled in just 1 week. Jessica Rank joining us now live from the hospital. And Jessica, these numbers not only as bad as we saw with the Delta variant, but UAMS says it could still impact an already fragile healthcare system here in the state.
Yeah, Bob, we've been talking a lot about these staffing shortages at hospitals all across the state, but now you're adding the growing number of positive cases among doctors and nurses, and UAMS says that could cause some bigger problems inside.
COVID-19 is not something that we can put in the rearview mirror at this point.
Long lines and numbers that continue to climb.
It's right smack dab in front of us.
Among these cars, UAMS says doctors and nurses are also getting tested.
It's quite possible that we could end up with 10 or 20% of our workforce on quarantine.
Dr. Cam Patterson with UAMS says it's a wake-up call. This week, nearly 500 staff members are positive or quarantined with COVID-19.
I'm very concerned about the resiliency of our care providers at this point.
Patterson says hospital staff is stretched thin, worried another surge could be the breaking point. This week, UAMS reported 49 patients in the hospital with COVID-19. Baptist Health with 159.
Even if it's only half as many patients being hospitalized for Omicron compared to Delta, if the total number of positive cases ends up being 4 or 5-fold higher, we're still going to have more patients that we have to take care of in the hospital.
Arkansas Children's currently has 13 kids hospitalized with the virus, stressing the importance of keeping staff healthy.
We're the only children's hospital in the state, so we have to be here to take care of kids.
Hospitals say it's important now to get ahead of the surge before the system becomes overwhelmed.
Omicron causes less severe disease, but that doesn't mean that the consequences of the Omicron surge are necessarily less severe.
Now that 500 that's out because of either COVID positive or exposures does not include the already staff shortage that they're dealing with here. And just to give you guys some comparison, I did reach out to UAMS before the pandemic. They said the average vacancy was somewhere around 150 staff members. Live outside of UAMS, I'm Jessica Rank for KARK 4 News.